All right. Good morning, everyone. I think we'll go ahead and get started, and others may still continue to join us as we go. Thank you for being here. It's nice to see everybody in the way that we see people now, which is through this wonderful technology that we have. So it's great. It's great to have you. We're talking about child sexual abuse prevention policy today, which is a really important topic. And I luckily get to just be your host and turn things over to our great partners at Awareness to Action, Department of Children and Families, and the Office of Crime Victim Services. And so I'll be here just kind of helping out in the behind the scenes and monitoring the chat. So please use that to share any comments or questions that you have as we go along, and hopefully troubleshooting anything that comes up. But I'm going to just turn it over to them, and they're going to take us through the session today. I also wanted to let y'all know that I am recording the session. I know we don't always do that, and I'm not even sure that we'll use it. I think it'll depend on how it turns out, but we wanted to have that as an option. So I just wanted to be upfront with you and let you know that that we are recording today. And I believe that Amanda's first, so I'm gonna pass it off to Amanda.
Thank you. I'm gonna make sure I can share my screen and try to attempt to do that. Okay. And I just need to get one other thing ready. Okay. Hi, everyone. It's been a long time no see for a couple of you, and so it's good to see you all. My name is Amanda Powers. I'm with the Wisconsin Department of Justice Office of Crime Victim Services. About a recent special condition that was added to folks' awards through OCDS that are federal pass-down awards. So I'm the VOCA administrator for the state, so I am in charge of making sure that we pass down our federal requirements, but also getting additional information from the feds to make sure that we are being as supportive as possible to make sure that you all can meet the special conditions. I'm joined by Teresa Nino today from our office as well. So Teresa, if I forget anything, please feel free to jump in. And also feel free to ask questions throughout. I will try to monitor the chat, but I'll probably do that towards the end. But if you have questions, feel free to interrupt and unmute yourself or whatever if you need to pipe in. I want to make sure that everybody gets their questions answered, because I'm not going to lie, this special condition from the feds is quite substantial, though. So I want to make sure that everybody gets their questions answered so that we can make sure that you're getting what you need to meet this requirement. So what is this special condition? So as most of you are probably aware, the funds from our office, VOCA, VAWA, and VAWA STOP and VAWA SASP are federal awards. So when we get special conditions from the federal office, we pass them down to you. So this is all US DOJ awards to Wisconsin DOJ through OJP, which is where VOCA comes from, and OVW have this special year 19 awards. And so we anticipate it being on our SASP awards at this point going forward. So we passed it down to you all, and we briefly mentioned it last year during orientations that this would be coming. We did from the federal government on this requirement, and we shared it through the bulletin, but we also have additional guidance on our website, and then we're also talking about it now. As with other things, I hope that people understand that, yes, as you have this special condition, like when we do monitoring, when we do anything, this isn't going to be a slap on the wrist. We're going to work with you to make sure that you can meet these requirements. So again, this isn't a punitive thing. It's included on all of our awards. And so we want to make sure that we can be a partner. And part of the reason that we're on this call today is we want to make sure that you have all the resources. And we're working with DCF and we're working with our other partners to make sure that you have the resources to meet these special conditions. So as it is, if you look in your VOCA award or in your VAWA STOP or VAWA SASP, we took the exact language that is in our award document and put it in your award document. It is a very basic language, in all honesty, of the actual condition language itself. But if you look on our screen right now, there's additional details that OJP provided, and then they provided additional information. And if you click on those links, and I'll share this this slideshow afterwards as well, it takes you to another another web page that has additional information of what actually is required to meet the federal special condition. And again, all of this information is included on OCDS's guidance document about suitability to work with minors, and we'll be talking about it today. Before I get into what folks need to do to satisfy this requirement, sorry, I got a little distracted. Before I go into what you need to do to satisfy this requirement, I wanted to talk about scope. It is a really broad scope. So anyone at the agency, their employees, volunteers, or others that are expected to or reasonably likely to interact with any participating minor fall under this special condition. So one thing I encourage folks to think about is, do you have any subawards or subcontractors who have individuals who might also work with your participating minors? So again, we have some agencies that contract out for different services, whether it's alternative healing or legal services. Consider those individuals that may also be interacting with your minors, and this special condition will also apply to them. And if you have any questions about who may be meeting or falling under this, talk to your grant manager, reach out to them. They can help provide that guidance and clarification. How to satisfy with, how to comply with and satisfy this requirement. So the key thing that you're going to see is the thread going through all of my slides is that you should have information on file. So there needs to be actual documentation that you have written determination of an individual's suitability to work with minors. So what do you need to do to consider their suitability? We'll talk about that later, but you actually need to have, for every individual, employee, volunteer, or other, if they're going to be reasonably expected to work with minors, a written determination that that person is in fact suitable to work with minors. So some of the things that you're going to be considering that are outlined in the guidance documents that we have is that you need to be checking the National Sex Offender Public website. So I have the link there. So it's the Drew Sojan National Sex Offender Public website. That needs to be checked for every employee, volunteer, or other at your agency that is reasonably expected to work with minors. So that's applicable to everyone. Everyone has to be checked in the national one. For Wisconsin, you also need to check the Wisconsin Sex Offender Registry because your agency is based out of Wisconsin and they will be working in Wisconsin. So I also have the link there through DOC for where you can check the Wisconsin Sex Offender Registry. Now, following that, if you have an employee, volunteer, or other who in the last 5 years has lived, worked, or attended school in another state, you will need to check that. So I think, you could have recent graduates who have attended a school out of state. You could have folks that have moved, or considering our states that border us. We have a lot of programs that are, fairly close to the border. So you may have an individual that lives in Minnesota and works in Wisconsin or Illinois or Iowa or Michigan, all of those states, you would need to check their sex offender registry. And it's different where you would find that registry in every state. So for Wisconsin, it's through DOC, our Department of Corrections. So I would encourage folks, if you're not sure, you can ask us and we can see if we can reach out to other state administrators for that information. But, the first place that we were suggested to start by our Criminal Information Bureau is look at the Department of Corrections, look at their Department of Justice in another state, or look at their Department of Health, or a couple of places to start that search for where you might find their sex offender registry. And again, please don't hesitate to ask us questions. We know this is a lot of pieces to go through, and we want to make sure that you're successful in meeting this requirement. And it's pretty extensive, so we want to make sure that you have the resources to check those boxes. What you should also have on file. So you also need to, after checking those sex offender registries, you also need to do a background check. I think most of you are already doing this. So it's the Wisconsin background check. And we encourage folks to also include the caregiver background check, because that checks if folks have been a child care provider or have worked in like a health setting. It checks their licensees for those pieces, that if they've been a caregiver. And I think that's an important piece of knowledge to have when determining someone's suitability to work with minors. Then, similar to checking registries, in states where someone has lived or worked or attended school in the last 5 years, you also need to do a background check for someone who has lived, worked, or attended school outside of Wisconsin in the last 5 years. So I will pause there just to take a breath. But if there are any questions, let me know.
Amanda, again, quick question. Yep. The Wisconsin background check, the background checks in state, is that in addition to the DOJ background, is that like checking references? Is that what that means? What does an additional background check in the state mean?
No. There shouldn't be any additional checks. So if you do a Wisconsin DOJ background check, that satisfies that piece of that requirement. Sorry for missing.
Thank you.
Yep. And again, so let's say, and I'll talk about this in a little bit, when we come to do monitoring, we're going to ask about these pieces. And if you have any questions, that's a good time to ask. And again, it's not going to be like a slap on the wrist. We're going to work with you to try to figure out what we can do to get you to meet this requirement. So to recap all that you should have on file to meet this, this special condition and satisfy it, you must have documentation that is reviewed and updated every 5 years. That includes reviewing and updating that you've checked the registries every 5 years, reviewing and checking background checks every 5 years, and you also need to review and update your written determination. So making sure that you're actually saying, this person is suitable to work with minors, that you update that every 5 years. We also strongly encourage that youth-serving organizations have policies and procedures regarding the prevention of sexual abuse of youth and children on file and enacted. So again, they should be written. We're going to be reviewing them. I'm not going to go into great detail about this because that's what several folks later are going to talk about. And they should address all 6 components of the CDC's guide, and you can find it at the following link. And again, that is included on OCDS's guidance documentation, and it will also, all of these links are included in our monitoring form. So when we come to monitor and we send a form, all of these links and this additional information will be provided in that. So as I talked about earlier, we are going to monitor to make sure that folks are fulfilling this requirement. So we're going to ask about your process. How do you go through checking all of these things to make sure that you have that documentation on file? Who do you check that for? So again, ensuring that you are checking any employee, volunteer, or other who is reasonably expected to interact with minor. Where do you keep that documentation? Do you keep it in a separate file? Is it their employee file? I do want to make it clear that we're not going to ask to see that because it's personal. There's personally identifying information, but we will ask you to do you have it in their employee file? Do you keep it all together for everyone so that all of this written determination is kept together? We're going to walk through that process. I just want to make sure that I kind of assuage some fears that we're not going to be looking at individuals' background checks because we don't feel that's appropriate to see that identifying information, but that we will be asking to you to certify that you are keeping that information and that you have it on file. And then how are you ensuring that every 5 years it's updated? Then for the policies and procedures addressing the prevention of sexual abuse of youth and children, these are the 6 pieces that the CDC outlines. So your screening and selecting tool for employees and volunteers. What are your interaction guidelines for working with minors? How do you monitor environments? How do you ensure safe environments? What is your response when there is, an instance or a report of sexual abuse? And then what is your training on prevention for those? And again, I'm not going to go into great detail because that's what folks later are going to talk about, but these are pieces that we're going to make sure that you have them. And again, because we strongly encourage it, if we do a monitoring visit and this isn't something that you have enacted, we're going to probably recommend it, not probably, we will be recommending it in our follow-up to your site visit that you enact these policies. And we'll again work with you and work with our partners to make sure that you have the tools that you need to get these policies and procedures in place and actually use these policies and procedures. So I'm a fast talker, so I probably went a little fast, but are there any questions, any pieces that I didn't address? Feel free to ask them in the chat or to unmute yourself and ask a question.
Sorry, this is Kathy again. I just have one question. So how does Wisconsin's domestic violence advocacy laws on confidentiality and VOCA's previous statement in some of our contracts about teen dating violence, is that going to be answered in some of the policy that's coming up? Because some of us have some of that as policy as well, specifically around that type of violence.
Kathy, could you clarify? I'm not quite sure I know what the question is. Could you expand on it?
You know what,
please?
Let me give it some more thought and look up the statute and then listen to see if it's covered in the presentation. And then if not, I'll come back.
Okay, sounds good. Any other questions at this point? I know it's a lot, it really is. And again, it's something that we understand that it's gonna take time to work up into a process. And I know that we've had questions before about, folks that have things come back on their background checks. We're not telling you that background checks need to be absolutely flawless. We're saying that you need to make a determination on that person's suitability to work with minors. So I just want to clarify that as well, which is why we're going to be looking at that written determination. And that's our piece of like, okay, you've checked all of these boxes. You've determined as an agency that an employee or volunteer or other is suitable to work with minors. And we're going to go from there. So I hope that's clear as well. And I will, if we're good, I'm going to stop sharing so that Caitlin can share. And I hope I don't mess this up when I stop sharing.
Thanks, Amanda. Folks, feel free again to type your questions or unmute yourself if you have any questions as we go along. Otherwise, we're going to transition to Caitlin, and she's either going to draw some pictures or share her screen, one of the two.
Good morning, everyone. My name is Caitlin Tolliver. I know that I don't know everyone on this call today. My role is the Trauma and Domestic Abuse Program Coordinator for the Department of Children and Families. So I help Sharon Lewandowski in managing many of the domestic abuse contracts that come through DCF. And therefore, for the agencies out there that don't receive domestic abuse funding for DCF, you don't know me, and that's okay. We've met today. I really appreciate Amanda's presentation. It's been great that this has been developed at the same time, and I really appreciate the assistance from A2A in helping to develop the supporting documents and the supporting educational pieces that are going to make these policies and practices really effective in when you're doing them and through your organization. So unlike the purpose for DOJ having to implement these new policy changes, DCF is implementing them really just because of how many children and youth serving organizations, how we interact so regularly with potentially vulnerable children. And that interaction really has been proven to increase the risk for child sexual abuse. So our goal is to, our goal is to implement a policy that helps to reduce that risk in our organization. So once again, this is for DCF funded programs. Can I get a nod if you're seeing this? Thank you. And it's about your policies regarding child sexual abuse prevention. Please ask questions if they arise as we go through this. So beginning January 1st of 2021, in all DCF contracts with any child and youth serving organization in which adults interact with children or youth, there's going to be new contract language. This contract language is going to focus on the policies and procedures that should be developed. And although the contract language is starting on January 1st, we really want to reinforce that meaningful policies and procedures should be developed, that just the implementation of a policy to satisfy a contract language is not what we're aiming for here. And so please take your time as an agency to think this process through, use TA, and make sure that it's something that works for your agency and that's going to really be impactful. Contract administrators will check that policies have been developed during site visits, but that content of the policy is really done on the agency level and not through DCF. So what you develop for your specific agency, it should be what works for you and what you believe it to be satisfactory to prevent child sexual abuse at your agency level. This is the contract language that is going to be added to the scope of services. I will read through a chunk of it. What it is going to say is that the program must have written policies and procedures regarding the prevention of sexual abuse of children and youth. Policies and procedures must address, at a minimum, the 6 components of child sexual abuse prevention as outlined in the CDC guide, which I believe we'll be going over later. So this should include screening, selecting employees and volunteers, guidelines on interactions between individuals, monitoring behavior, ensuring safe environments, responding to inappropriate behavior, breaches in policy, and training about child sexual abuse prevention, which you saw all in Amanda's presentation as well. So there's absolutely significant overlap here between what DOJ is requiring and what DCF will be requiring moving forward. Here's my contact information if you need it. But yes, those 4 slides is what I had to share. Are there questions about that? Here's my, in case anybody's wondering, CDC. I absolutely, I really appreciate the work that A2A has brought to this. Mary's going to talk more about, I think, really using the CDC guidelines and translating will be meaningful for programs is key moving forward. So thank you.
Great. Thanks, Amanda and Caitlin, for sort of kicking us off with what will be required and recommended. So there's not any angst about that, as Mary's talking about best practices and the work that they are doing in supporting programs around policy development as a strategy to prevent child sexual abuse. And so so thanks to Amanda and Caitlin. If you have additional questions, even as you're hearing the best practices, that might be when some of these questions pop into your head. Feel free, because Amanda and Caitlin aren't going anywhere, even though we're transitioning to Mary. So again, go ahead and use the chat or unmute yourself if you have questions as we go. But we're going to spend the rest of the time then really focused on those best practices that Amanda referred to in her session. And we're super happy to have Mary Clayman here, who many of you may know, depending on how long you've been around in the field. Mary used to be an executive director of a sexual assault program. And so she's really familiar with the work that you do, as well as one of our favorite partners here at WCASA. So, and I know she's got, I think Abby's here as well. So thank you both for being here, and I'm going to turn it over to you. Thanks.
Thanks, Kelly. Good morning, everyone. I think that was Kelly's nice way of saying that I'm old, that I've been doing this for a long time. And I do see some people that I recognize. And also Abby Kibar is on as well. I am a prevention manager with Children's Wisconsin, overseeing our child sexual abuse prevention work. And Abby, you want to do a quick introduction?
Sure. I am the program coordinator for the Awareness to Action program, so under Mary, and I do a lot of my work revolves around the policy and procedure training that Mary will be going into.
So I am going to share a screen as well. So can somebody give me an indication if you're seeing my screen? Perfect, thank you. So for those of you who might not be aware, Awareness to Action is an initiative focused on preventing child sexual abuse and specifically around teaching adults and communities how to protect kids. As a former director of a sexual assault crisis center, I know that we did a lot of work with having prevention educators going into schools and teaching kids how to stay safe. We're not minimizing that work at all. That is important work. But what we really want to focus on is helping adults and teaching adults how to keep kids safe. We're a program of Children's Wisconsin, and our work is funded by the Child Abuse and Neglect Prevention Board. I'll get it right out of the way automatically that one question that always comes up is, when we provide support or when we provide training, is there any cost? And there absolutely is no cost for any of the work we are doing right now because it's all been provided through that grant. What we've heard over and over this morning through the CDC document and all that, best practice is about minimizing risk. Really what we want to get to is a place where when we implement best practices around protecting kids, no one's questioning it. Our training that we come in and do focuses on the CDC requirements, which you have seen over and over. I said requirements, but they're guidelines around how child-serving organizations can protect kids. We have a training that we come in and give to organizations and in communities that go through each of these components, have you develop a plan around them, and then follow up at 3 and 6 months. Abby will go into that a little bit more when I'm done, to really support you. What I like, and I can't remember which of our previous presenters said it, but all of this has to be done by an individual organization. It's really difficult to go in and give you a checklist or give you a just a template that you can pop your name into and you're done. This really is work that's done on an individual level because each organization is different with unique pieces around, you know, if you are a dual agency, do you have a shelter? Don't you have a shelter? Do you have people coming in to do groups? All of those things need to be considered as you go through each of these components and how it's going to work within your individual organization. So when you look at the first one, the screening and selecting of employees and volunteers, there are really some very specific things that you need to do about checking registries and doing all of that. But really it goes far beyond that, and not only considering your employees and volunteers, but, you know, do you have youth volunteers? That's something that's often overlooked. Do you have any type of questions that, do they go through an interview? Is there a form that they fill out? All of those pieces. And you know that there are some really good questions that you can ask when you're either interviewing employees or interviewing a volunteer that can give you insights into what their thoughts are and see if there's something that maybe raises a little bit of a red flag for you as you move forward with doing them or hiring them or bringing them on as a volunteer. What you're seeing on your screen right now is when we come in and do the training, each organization fills out a form where they're talking about how are you doing so far on this component, And you'll see in number 4, what do you think you can improve on? And then what are some barriers? When you leave our training that we're doing right now, you leave with that plan of work. These are some very concrete things that I can go and I can make happen right now in my organization to help keep kids safe. And then what are some of those barriers and how can we help you overcome those barriers? So after each component, we go through that. I should probably say that the training is very video driven. We have brought in experts in the field of child sexual abuse and child sexual abuse prevention. Some of you who have been around for a while probably have heard of Dr. Anna Salter. We have interviews from her. We have interviews with individuals who have already gone through the training and what they've done for their organization. I don't know if any of our friends from Wise Women Gathering Place are on, but that is a sexual assault organization that has already gone through the training. They talk about some of the changes that they made. So it's a very dynamic presentation from that standpoint. If anything, some of the information, you're going to go, yeah, I know that, because we do talk about grooming. We talk about some of those other pieces that people who aren't as familiar with the field of sexual abuse of children might not be that aware of. And sometimes I think we assume staff coming in or our volunteers are aware of information that they might not be. So it's always a good idea to go over some of this information. The second component is guidelines on interactions between individuals, and that's to ensure the safety of youth in their interactions with employees, other volunteers, and with each other. And we always have to be cognizant of that with each other, because we know the statistics around how many kids are sexually abused by powerful or more older youth. And again, the whole idea of one-on-one situations. I'm going to play just a little bit of this because you are all very aware of grooming behaviors, but it will give you an idea of some of what is in the video presentation itself. Oh, and it didn't play. Let's see if I can get it to play.
Hey, Mary, this is Kelly. We can't really hear the video on our end.
Okay, so we will stop the video. Let's just go on to the next. So if you were able to hear it at all, basically it's Anna Salter, excuse me, Dr. Anna Salter talking about grooming, and goes through all of those pieces and what youth serving organizations might see when a perpetrator is trying to groom a child. And there's also a big emphasis on grooming the family, talking about how perpetrators will groom the family and groom their coworkers into thinking that this is someone who would never do anything like that, would never want to hurt a child. And I have to say, as someone who does this, has done this work, I can't say as an executive director, I ever really thought about a perpetrator coming into work for my organization. And that's something that we have to think about regardless of where we work, regardless of who we're bringing in. There's always that possibility. Which brings us into the third component, which is monitoring behavior. This is a component that we stress and we spend a lot of time on because What we want to stress is we don't think that everyone coming into an organization wants to hurt a child. We know the vast majority of people who come to work for organizations really want to help and support kids. The issue comes in that we can't tell who that one person who might want to harm a child is. And that is why it is so important that conversations be held within organizations. Open, honest communication around, these are our policies, we have to make sure these policies are followed, and what happens if we see someone who's not following a policy or is doing something that is a boundary violation with volunteers or other staff or with kids. What we want to do is create an environment where these issues are discussed. They're not swept under. We don't assume the person, well, they're not the kind of person, I'm not going to report that. And by reporting, again, we're talking about having a conversation. Staff and volunteers should feel comfortable coming to whomever you designate within your organization with those types of concerns, and that leadership can call staff or volunteers in to have a conversation, so that if it's a one-time incident of a boundary violation and the person certainly didn't mean anything by it, it was completely innocent, it's done. What you're trying to find, though, is if there is someone who this is a continuous pattern, that people are constantly, not constantly, but consistently seeing issues with the way they're interacting with youth, with things that are going on, that you can discern a pattern, and then it becomes a concern. If you don't have an environment where those things can be brought forward and talked about, those patterns don't emerge. Again, we have individuals talking about this in the training, saying, you know, grooming behaviors aren't always going to happen in front of the same person. So one person may see something and someone else might see something. What you're trying to do is put together a concerning picture of a possible grooming that is going on. So document, and if you've got files that you have to put together now because of the requirements, those types of things can go right into those files. And again, if it's a one-time incident, you've talked about it, everything's good, nothing more needs to happen with it. What you're looking for are those patterns that might develop. And again, are incidents documented by the person who observes? Are reports reviewed? Do changes need to be made? Because some of that comes up too. You may create a policy and find out it's not working or something different needs to be done. These should all be documents that are revisited and brought to life within an organization. And I'm just going to skip the video because for whatever reason, they're not working. So number 4 is ensuring safe environment. So
Mary?
Keeping youth from situations. Yes.
If you want, I think if you unshare and then reshare and check the boxes in the bottom, it should work. So if you wanted to do that real quick, we could take a second if you'd like to share the videos.
Okay, so let's see it. I stop share.
Yep, and then when you click share screen, you will get 2 little boxes at the bottom of the box.
2 little boxes. Oh, there we go.
Check those. And then click share again and then try it again and see if that works.
Okay, let's see. Let's go back. Oops, I'm on the wrong screen now.
Well, written policy really doesn't do anything by itself. One of the things that happens is
Are you able to hear it, Kelly?
will see something that is short of sexual abuse, like a teacher walking down the hallway holding hands with an older student. And it makes them very nervous. It doesn't seem right, but they don't know, they can't say it's sexual abuse. So they don't report it because the organization hasn't made it clear that they want anything reported. Someone else may see the teacher in the classroom with the lights out. And that's odd too, but it's not enough for a formal sexual abuse report. But if you put all the observations together of different people, you may have a very worrisome picture. Someone else may have seen this person taking the kid somewhere in a car, for example. So organizations have to develop not just a piece of paper, but a culture in which people understand that if something strikes them as off, there is some place that they can go and take those concerns to, and that supervisor or person can put them all together. So if you just have a policy that says, well, if you see sexual abuse, you might want to report it, or you have to report it, you're going to miss all the early signs of grooming, because they're not all going to occur in front of the.
Our basic foundation is peace, respect, and belonging for everyone and everything. And this way of having a conversation about the possibilities or about things that have happened to give everyone a greater understanding of what needs to happen and how things must be done.
Our program in the past has talked with parents and social workers and other people that work with the children at the time a case closes or on an annual basis to get feedback about the volunteer. One of the things that we decided while going through awareness to action is we would like to do that more regularly. So we want to contact the parents and foster parents and social workers and teachers of the children to see how that interaction is going, and also do more shadowing of the volunteers so we are actually there seeing the one-on-one interactions with them and the children.
All right. Number 4, and I completely lost everyone when I'm doing that. So Kelly, you're going to have to let me know if there's any questions or anything going on. Number 4 is the ensuring safe environments, the goal of which is to keep youth from situations in which they are at increased risk. So when you look at environments, as I said,
Mary?
Yes.
Sorry.
Yes.
We're seeing the wrong screen now. It looks like we're just seeing your desktop.
Oh my goodness. We are just having fun, aren't we? Let's
Technology is
again.
wonderful. Let's try again. There we go. That's great.
Let's try again. Okay. Now I can't see you at all, so please keep telling me what's going on, because this is just so much fun.
Yes.
It's not a Zoom meeting without issues, and I hope you all have your bingo cards ready, because I think I filled most of them with my presentation. So with ensuring safe environments, again, the goal is to keep youth safe. And this is really one where, and Abby can attest to this, a lot of organizations just want to check box, let us put things in, but every environment is so different. And you need to take into account, do you have kids coming into your buildings? Do you do groups? Do you have a shelter? All of those pieces. What are the requirements around using the restroom? What else do you have in your organization that you need to change and to make sure that all of the environment is safe? Another piece is around how do you respond to inappropriate behaviors, breaches in policy, and allegations. That again goes back to you and your organization determining what is just a breach in policy and helping your employees and volunteers around what absolutely has to be reported. So you're talking about both. What you want is the environment where it's discussed, and then absolutely when there is that suspicion of child sexual abuse, that it is reported. Some of these are what we go through. Again, do you have policies that define what behaviors will be responded to, what ones will be done internally, what has to be reported to authorities, How do you act on those infractions and report any employee and volunteer that witnesses? Then training around child sexual abuse prevention. And again, the emphasis here is on the prevention, to give people information and skills that help them prevent and respond to child sexual abuse. Some of the resource materials that we have through A2A really talks about the resources. So what I want to emphasize is we're going to talk later about how to bring the training to your employees, volunteers, to your community, other youth serving organizations. But I want to emphasize that the materials that we have through A2A are available to anyone. So even if you don't bring us in to do a training, please contact us, because we have a lot of resource materials around the CDC document. Everything that we do is based on the CDC training. So please be sure to contact us, even if after we're done, you decide you're not going to go through the training. We have a ton of resource materials. Let's see if we can do one. I think I am going to skip that one just because I do want to spend some time. Abby, I'm going to stop for a second because I'm going to go a little bit more into Stewards of Children, which is a prevention training that we support. It's headed up through Darkness to Light. And we help organizations bring that training in. But I want Abby just to spend a little bit of time more around how we do our policy and procedure training, how you can bring it to your organization and to your community. So Abby, you want to take this?
Absolutely. And just a forewarning, I have a 7-month-old in the background, so you may hear him babbling a little bit. So we'll see if his toys keep him busy. But yes, thank you, Mary. So these are the training details, like Mary said. So we go into organizations, communities. We start with an initial 3-hour training. It's about 3 hours. That's very video-based, like Mary had said before. You're hearing from experts in the field, as well as participants that have gone through, sharing some of the things that they've done. We go through each one of those components, and after each component, we stop to let you fill out a work plan. So as Mary shared before, that sheet that kind of goes through some of the different areas in each of those components, that how your organization is doing. You rate yourself, things that you think that you can work on, or things that you're doing well, and then barriers that you find. So after each component, we fill out a work plan that is designated or specific to your organization. Then we also open it up for discussion at that point, so organizations can share, hey, we're doing really great work in this area. I think we're going to have to do some work in this area. Sharing of ideas comes in at that point too. So that's in that first initial 3-hour training. We like to have about 6 organizations go through together at the same time, so that when we come back together, so as you can see, we make a concrete action plan, and then technical assistance and support comes after that. So we come back together at 3 months, and then again at 6 months with that same group. And that is really just an open forum for organizations to talk about what they're doing, anything that they've tried to implement just isn't going well, or things that are going well, and then share those policies and those procedure changes with the other organizations that have gone through it. That's also a time that I bring policy and procedure changes that other organizations have done. I bring those with me as well to share with organizations that have gone through, so we're not recreating the wheel. If something's working for this organization and it can work for yours, let's make that happen and make that as easy as we can. And then, as Mary said, she'll talk about stewards in a little bit, but we get you access to those trainings. I am a facilitator, Mary is, that we have many facilitators throughout the state, so there most likely is one in your community we can connect you with to bring that training to not only your staff and volunteers, but also maybe to parents or just others that might be coming to your organization. And then after that 6 months, we don't just say goodbye to you. We have quarterly newsletters that are going out. We create a community of practice that's more than just the organizations that you've gone through the training with. We've broadened that now that more organizations have gone through. So we've kind of chunked them into, oh, we have 5 or 6 schools that have gone through. Let's create a space where they can share the things that they've done. We've had this many DV centers go through. We've created a space where they can get together and talk about the changes that they've made. So we've really brought in that to organizations that are alike, and then also organizations that have gone through the training together. Am I missing anything, Mary?
No, thanks, Abby. I just want to stress that what Abby is talking about, and some of what I've alluded to before, is how we've done the training in the past as we've gone into communities and opened it up to any youth serving organization in that community that is interested, and then bring them together to work as a community. We've been working closely now with WCASA to engage the sexual assault service providers in those communities, so that when we come in, the sexual assault service provider is involved not only from the standpoint of going through the training, but then also being that expert within the community that stays there once Abby and A2A has delivered the training, because those resources and those supports are there. We have done a training with WCASA staff and some others, and our hope is moving forward that, well, we are doing it. How large it gets is somewhat dependent on demand, but we are now implementing a train the trainer model, so that we can also leave the training within the community, so that there's that community component. Because as you know, our goal is not only to keep the children that are participating in your activities and programs safe, but to get that word out to all youth serving organizations. And I see we still have youth serving organization, and the CDC has youth serving organization. We have just gone to calling it organizations, because so many that we work with don't see themselves as youth serving organizations. Sometimes libraries don't see themselves as youth serving, yet we've had a lot of libraries go through. And there are other organizations like that. So really, anyone who's interested in doing this, we will come into a community and do the training. So that's the piece I want to encourage you is, if you are interested in having a full-blown training come into your community, to contact either Abby or I, because then what we would like to do is open it up to other organizations in your community as well.
Yeah, and I'll just add to that, Mary, too. We keep talking about how we come into the community. So that is looking a little bit different now. So we have adapted that to online, so we can do those via Zoom like we're doing today. And hopefully at some point we can get back out there and do these in person, or maybe even do the follow-up, the 3-month and the 6-month in person. But right now we do have all the tools that we need to be able to do it virtually.
Yes, thanks, Abby. So again, we just talked about that. When you talk about the education component, stewards of children, some of you are familiar with, I know many sexual assault service providers have facilitators within their organization. So Stewards is a presentation from Darkness to Light in South Carolina. It is evidence-based and emphasizes adult responsibility to prevent child sexual abuse. They have 5 steps within Stewards: learn the facts, minimize opportunities, talk about it, recognize the signs, and react responsibly. Since Stewards of Children has a workbook that every facilitator needs to have, so you need to be become a trained facilitator. It costs $350. You need to have access to a workbook, and now they have taken it virtually, So a virtual workbook that every participant has to have, and those are $10 a piece. So it is an expensive training, but again, we support stewards of children throughout the state, through our grant with the Child Abuse and Neglect Prevention Board. As part of that, we distribute a pre and a post test. And this is just some of the results that we have seen. I can't remember which year this was. This might be from 2 years ago. But if you look at some of them, there's some great data in here. And I especially like to look at number 8, that I believe fewer children would be sexually abused if adults made more conscious choices about the situation in which children are placed. 50% agree pre-test, 92% agree post-test. So what this training can really do is give adults the tools to say, yes, that I can make a difference in the lives of kids. I'll just go back. Almost everyone who attended felt the facilitator was well prepared and knowledgeable, and most reported 98% that they would recommend the training to others. So that is another tool that we have right now. As everything else, stewards has gone virtual with the training itself. Invite anyone to come and have a steward. Many, as I said, communities and sexual assault service providers have facilitators within their organization. If you don't and you're interested in having someone become a Stewards of Children facilitator, Darkness to Light has not yet opened that up virtually. So once that does open up virtually, we will have another Stewards of Children facilitator training. I'm not going to play the stewards videos. Please go on Darkness to Light's website. If you don't know about stewards yet and you're interested in it, they do have the ability to take the training virtually for free. They don't advertise it very well. But if you're interested in it and you go on to Darkness to Light's website, it's the Flip the Switch campaign. And when they ask find out more about stewards, and then if you're interested in Stewards of Children in the state of Wisconsin, again, you can contact either Abby or myself. And this was a lot of information to go through. And I think all of us did it fairly quickly. I know there are pieces that I skipped in the training just because of the audience that we have. The training goes some through ACEs and, like I said, grooming and other aspects of child sexual abuse that this audience really didn't need to hear that much about. So with that, I just want to open it up to see if there are any questions that we can answer. I see, are those prevention flyers available electronically? Yes. Can you share them on social media? Yes. I'm going to warn you right now, our website is under construction. It's very ugly right now. It was very pretty. And then we had to change it to adapt to the environment of people coming in from their smartphones. And when they did that, they made it ugly. So we're making it pretty again. But the material is available. And Abby, maybe we can send the link out to Kelly and she can get it out for them.
Yep, we'll compile all the resources from today and send it out to the listservs. So we'll make sure to include that too. Thanks, Mary and Abby. And so now we'll just open it up. If folks have questions or thoughts or comments, feel free to unmute yourself. And we also have the chat open. So if you prefer to ask your questions there, please let us know. Now's your chance. And we still have Caitlin and Amanda. So if you have questions more specific to the requirements and recommendations, they are here too. I know there are a lot of people who have staff who have been through the Darkness to Light training. I know we hear that a lot from sexual assault advocates from across the state. So if you are doing that and that's going well in your community, this is a nice sort of additional piece that takes us a little bit deeper into prevention efforts. And we know that policies and practices are an important part of that social ecological approach to prevention. And so this really is a nice opportunity to kind of combine your prevention work with some of your more logistical, like grant requirements. And sometimes we think of grant requirements as just that, as requirements, which we know we have. But at the same time, like, this is an opportunity to utilize or have the requirements be the impetus for you to really operationalize some of your prevention efforts, not just within your program, but as Mary said, within your community with other folks who are working with youth. So I think it's a really nice opportunity. It looks like we have some questions coming in.
Yeah, I see one, Kelly, about if we wanted to host a training and the recommendation is for 6 organizations, would more be able to participate? Absolutely. We have had more than 6. We have had less than 6, to be very honest with you. We really just want to get this information out. And what we find is, you know, I used to do the trainings a lot. Abby takes the lead now. As soon as we go in, the community is going, oh, and this organization should be here, and this organization should be here, and this organization should be here. So there are several communities where we've gone back, because once organizations start, they see the benefit of all talking about this together.
Great. Thanks, Mary. Looks like we have another question. Is the individual suitability requirement for VOCA funded staff only?
No, it applies to anyone at your agency that is going to interact with minors. So that's why it's super broad. Quite frankly, for DOJ ourselves, for considering who is going to, that requirement is going to be applicable to, I know HR is going broad, because it is any employee, volunteer, or other that is reasonably expected to interact with the minor. And it doesn't define that as only minors in a VOCA funded project. So again, fairly broad.
Great, and I think that answers then the, is this policy required if we are not DCF funded? So I think, Amanda, you kind of addressed that.
Yeah.
Yeah. Do staff and volunteers only need to be trained once or every 5 years?
I'm not sure about the training piece, if that is for VOCA. So could someone clarify that?
So you're asking, Amanda, is the question specific to VOCA?
Well, I'm not like the training piece. So like for VOCA, I'm trying to think of, I mean, the once every 5 years for VOCA applies to how frequently you're reviewing the registries and the background information, and then how often you are updating and reviewing that to update the written determination. So I think maybe that's the piece. But for the training piece that's talked about that Mary was talking about with the CDC stuff, I know that that is a component. I don't think there was a reference to years in that, but that is one thing that OCBS will be checking, is that you're doing training on prevention for child abuse in your agency. So hopefully that addressed the question. If not, email me individually and I'm happy to address that.
Question, I
and
think,
Amanda, I was just going to say, I think sometimes when people see the word training, they're thinking about a 3-hour sit-down training and whatever. Know that you can do training and information for staff that can be quicker. I know Abby has put together real quick snippets around that come from our training. So, you know, my hope is organizations would keep some kind of component alive throughout the year, and not just every 5 years. Yes, some big training, but the whole idea behind the CDC and what we're trying to do is make this part of the organization so that it's something that is in front of staff all the time in some way, not necessarily always some huge 3-hour training that you have to bring everybody together for and do that type of work. Hopefully by the time you're done with the training and the policy and procedure work, this is something that lives and breathes within the organization, and it doesn't feel like such a heavy lift all the time. I did see a question, Kelly, about would it be better to have 6 from our community or 6 DVSA programs that are nearby? Really, the training can look like what you want it to look like. It's what makes sense for your organization and your community. So Abby and I are willing to work with anyone who wants to bring it in to look at what's going to be best for your organization and your community.
Great. Thanks, Mary and Amanda. And like, there was a question too about virtual, it sounds, and Abby talked about that a little bit. It sounds like you're able to start this at any point now, you know, in the near future during this COVID time, would start virtually and maybe transition into in-person whenever it's safe to do so.
Yes, absolutely. It is online, so we can do.
Okay.
Kelly, I just wanted to add something to kind of piggyback off of what Mary was saying, and I think Caitlin kind of mentioned this in her presentation as well. The written policies and procedures, like everyone has said, like, yes, they need to be written, but we also want to make sure that it trickles down to the folks that are interacting with the minors, and then it's, you know, again, I think a lot of times when we're on monitoring visits, there are some really great policies and procedures that folks have for their organization, but again, it's not maybe necessarily always getting down to the folks on the front lines. And so I think that's a really good point that Mary brought up, that it doesn't have to be this 3-hour thing, that if you're bringing it up into regular staff meetings and discussions about, you know, like as a reference, this is where you can find this information, let's talk about this. I think that's key for us too, because as Caitlin said, just checking the box that we have this policy and procedure, while great to tell the feds that we have this policy and procedure, we also want to make this a worthwhile thing, because I think everyone on this call is in the same place. We want to prevent sexual abuse of children. And so again, making sure that then this is a meaningful document and a meaningful policy and procedure that actually has, like, is integrated into your organization is what we'd really love to see, and why we hope we can partner with all the agencies on this call to make sure that we can help our programs achieve that.
Absolutely, and that's one thing that we consistently talk about in the training component is, I'm sure all of you, when you started with an organization, signed all of the documents and you signed everything, and if you have to go back and say what any of those said, I know I couldn't, because you're so overwhelmed. And that's why it's bringing these pieces back and making sure staff are aware and working with them. And again, that should just be part of what's going on within the organization.
Great. Thank you both. Other questions? I know I hope we've covered all the ones that are in the chat so far, but if you prefer to unmute yourself, you're welcome to do that as well. Sometimes the complicated questions are a lot to type, so feel free to unmute yourself too. As folks are thinking and typing, I'll just remind you all that we'll make sure to compile the resources that were shared today, PowerPoints as well as links, links from the chat. Thanks to both Amanda and Angie. I know dropped some links in the chat as we went along. So we'll make sure to pull those out as well. So when we're sending everything, we hopefully will have have it all the things you've asked for, as well as contact information. I know some of you are very familiar with our guests today, but for others, you're maybe not connected, either because of different funding or anything like that. So, so if you need to reach someone, we'll hopefully have that all connected. Looks like we have another question. What is the date that these policies need to be in place?
For VOCA, there isn't a specific date. We would hope that you would be working on it during the grant year. But again, as I think either Caitlin or Mary said, you know, we don't want you to just have to feel like you have to slap a policy in place to have one in place. We want to make sure that you can work through, you know, making it more applicable to your agency. So again, if you were to have a monitoring visit this year and you didn't have it, but you said you were working on it, like, we understand that. And generally following site visits, we give folks several months to develop policies and procedures, recognizing that there needs to be board approval and you've got to have all these pieces in place. So without like giving a great answer, I would say to try to work on it during this grant year, you know, and if you get something that you feel really great with at the beginning of the grant year and you can approve it, wonderful. If you need some more time, that's understandable too. We understand, because we're still in the process of getting this in place for DOJ itself. So I hope that was a good enough answer, but again, try to get it in during this grant year. So for VOCA, that would be September 30th, 2021.
Hi, Marianne, and same for DCF and DCF funded programs. This will be in contract beginning January 1 of 2021, but really I want to continue to reinforce that this is about a meaningful policy and procedure. I encourage you to utilize the tools that A2A has already developed and continues to develop. I encourage you to participate in any training or TA opportunities. And really, we have found from DCF that policies are much more impactful when they're developed with a whole group from different pieces of your organization. So meaningful development is priority number one. And yeah, I don't think that anybody will be getting a slap on the wrist for not having a policy on X date within this grant year. So if you are concerned about it being completed within the next year or so, just reach out to your contract administrator and talk to them about it.
Caitlin, that's a really good point, that just to let organizations know, more than one person can attend the training. We have had organizations, I think it was a Boys and Girls Club, that sent 6 or 7 people because they had multiple locations, multiple programs. You know, you might have a different policy for program A than you do for program B, just because they're different environments. There's different amounts of volunteers or staff, maybe it goes off site. So know that when we do a training, we're not saying that just one person from that organization can come. Anyone that's involved with the kids and programs that you would want to send can certainly attend.
Great, thank you. It looks like there's maybe a little bit of a confusion between the requirements of the written determination, the registry checks, and the background checks with the recommendations from CDC, those core components. So can Amanda or Caitlin maybe address that?
Yeah, I can. So the special conditions, the registries, the background checks, that is required. You have to do it for everyone that interacts with minors. We are also strongly encouraging that you enact these policies as well in conjunction with that, to kind of, again, universally look at how are we preventing child sexual abuse at our organization. And it will be a thing that we monitor for is, does your agency have a policy that addresses these 6 components? And if you don't, we'll encourage you to work with A2A and our office in DCF and WCASA to make sure that you have these pieces in place. So all of these are included in OCDS's guidance, and that we will be looking for those pieces. So while we use strongly encourage, it will be something that if you don't have these policies, it will be a recommendation from our office that you enact these policies, and again, work with the organizations to get there, because you know, it's good policy. It's good to have these in place. So I hope that helps.
It seemed to, in the chat, it seemed to answer the question, so. Other questions? These are great. Thanks, everybody.
And to, kind of one final thing, again, if you don't have these in place, don't be afraid to reach out and ask us for help, whether it's DCF or us or WCASA or A2A, because that's our whole point, is like, we're just here as a resource for you. Yes, there are these things that you have to have in place, but we don't want it to feel like it's a slap on the wrist that you have to rush to get these in. And so just using all of our offices as a resource is what we're hoping that you get from this presentation today from all of us.
And I appreciate, Amanda, that you're talking about, you know, there's a difference between rushing to get this all done so you have a policy so that you can check it off with either Amanda or Caitlin's office, as opposed to really thinking through some strategic areas that you might not have everything in place, but as you're working toward it, what's really going to work for your organization.
Did we have someone else that was maybe going to ask a question?
I was, and now I can't remember what it was. I did put it in the chat. United Way of Greater Milwaukee and Waukesha County does require a child sexual abuse prevention policy from all their youth serving organizations. So we would have lots of access to samples of what like shelter programs have done, youth serving organizations, all different kinds. So if people are interested in that, it would be, you can reach out to me and I'll forward it to Dawn Helmrich, who reviews all those policies for United Way. And we've used kind of the 6 steps and those kind of things.
Oh, great.
Remember my question. So I work for Aurora, Advocate Aurora, 70,000 employees. I'm assuming for this area, it would be our department, which is nurses and, you know, lots of folks, but it's, I'm assuming it's not for all of Aurora.
Marianne, I can get clarification on that for you.
What?
Marianne, I can get clarification on that for you.
That would be great. Thank you.
Yep.
And I appreciate Marianne bringing up United Way of Milwaukee. We have some staff from DNR on the call here specifically because we're reviewing our sorry, the policies that we're talking about, we're reviewing them as well. And we want to make sure that the requirements of United Way, the requirements of OCA, and the requirements of DCF all go into one policy. And so we are going to have a team reviewing that. But Marianne, any support we can get from you as well in that, we will probably reach out to you. So thanks for the work there.
Awesome. And I can try and connect with Dawn even before I send out those materials and see if she has some samples. Dawn's on WCASA's board, so I can connect with her and see if there's anything that she can share, and I'll include those when I send out the materials. So thank you. Any other questions or thoughts? I see in the chat there's also lots of appreciation, so I will echo that and say thank you to Mary and Abby, Amanda and Caitlin for leading our conversation today and sharing both grant requirements and recommendations as well as those best practices. And we really look forward to continued collaboration on this important topic. So as you identify training needs or technical assistance needs or whatever that might be for your organization and your community, please let us know. And we're going to, whoever you reach out to, we're going to pull each other in. And so if you're reaching out to WCASA, we're going to pull in Mary and Abby, and then make sure that your funding partners are also aware and helping, so we make sure that we're getting you all the support that you need to do exactly what everyone has said today. Find a way to not only ground this important work in what's required, but also really push forward and look towards those best practices, so we're all doing what we can in our organizations to keep kids safe. And I know that's what we all want to be doing, and so we want to do that in the most thoughtful of ways. So please let us know how we can help at WCASA, and know that we also will be pulling in our other partners. If you have other resources that, I know there have been lots of communities who have already participated in some of this policy work. We saw our friends from Wise Women Gathering Place in one of the videos. So there are programs out there who have already started this work. And so if you have resources that you'd like to share, please put those on the listserv. If you prefer not to do that and you want to share them with me directly, you can do that, and I can send them out. But we want to make sure that we're sharing collectively how this is going and supporting each other as we move through this important work. So I'm not seeing anything else in the chat. So I think we will wrap up for today. Thank you again for everyone who joined, and thank you to our speakers. And we look forward to more conversations on this topic as we work through this policy development in your organizations. So thanks, everybody. Good to see you. Have a good rest of your day.
Thanks, everybody.